Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Good morning, I'm Dr. Kerry Gelb, and welcome to Wellness 1280 on Open Your Eyes Radio. Please listen as I discuss the newest information in the world of health, nutrition, and sports every Saturday morning, 6 a.m. Central Time on 1280 The Patriot. Also, please share your thoughts by emailing me at drkerrygelb@gmail.com. That's drkerry@gmail.com. And visit my new website, wellness1280.com. where we have all the guest links and information and things about shows and learn about our guests. So we're back with Dr. Elizabeth Yurth. She was kind enough to come back for a part 2. We're learning so much about peptides, anti-aging. Everybody out there wants to learn how we could age slower, age better. We talked a lot in the first episode, a little bit about hormones, about a little bit about diet, how much protein you need, and now we're into the peptides. So we finished up last time on BP 157. Dr. Yurth, was there anything else on BP 157 before we go to the pineal gland peptides that you'd like to mention?
So I think, guys, it's just a really good one for you guys to keep in mind because it's really easily accessible, as an oral supplement. I think that, again, if you're somebody who is an athlete who either is prone to injuries or getting your head hit, if you've got kids who are playing sports, if I had a kid who played football, I would have them taking BPC every day because of its neuroprotective effects. So honestly, I think it's just one of those ones you really need to keep in mind because it's one of the few things that's pretty easy since you can take it orally. So just keep that one on your radar.
Well, we're going to go into the pineal gland, the pineal gland produces melatonin and something called epitalin, and it's in charge of a circadian rhythm.
Right.
And it's in the middle of our brain and also calcifies as we get older. So if you could talk about that peptide, why we want to replace it, and how that could help us.
As we talked about, as we age, we want to replace everything we're losing. And pineal function is one of those things that, unfortunately, much like thymic involution, our pineal gland tends to calcify with age. And that's one of the reasons as we get older, you look at older people, they're disrupted. They sleep more during the day. They don't sleep well at night, right? Their whole circadian balance is out of whack. Now, I will emphasize here that most of us are out of whack from a circadian rhythm perspective because we sit in front of our computers all day long instead of being out in the sunlight where we're supposed to be. So your first thing to emphasize, you really want to keep your circadian rhythm in balance, is you need sunlight exposure. If you can't get outside, get a full UV spectrum lamp so that you can get UV during the day. You need to get sunlight during the day and dusk and dark. So first morning sun, afternoon sun, and you need to get dusk. So if you're on your computer late, guys, working, use red light glasses, things like that, try and stimulate dusk. That's really critical because we now know that imbalances in circadian rhythm are linked to almost every disease, and particularly cancers. It's why when you look at shift workers, they have very high incidence of cancers. So how do we, if I'm fighting the fact that my pineal gland, which is the biggest sensor of my circadian rhythm, it's the light-dark sensor, something called suprachiasmatic nucleus. It sort of senses time of day and when I should sleep. So if I don't have that anymore, how can I fix this? And so we can, much like the thymic peptides we talked about, right? We lose thymic function. Let's give back the peptide they make. So one of the things that the thymus gland makes is epitalon. And epitalon is a sort of key regulator of circadian rhythm. And I love to use this peptide as a twice a year circadian reset, basically. So I use a pretty high dose, like a 10 milligram dose for 10 days, twice a year in my longevity protocols. You can also use it at a smaller dose on a more regular basis, particularly if you're fighting jet lag, things like that. You can use it to reset jet lag, so you can use a smaller dose in those kinds of perspectives. But it's going to be actually that piece that's going to reset circadian balance. And I think that's one of the, again, when we look at pieces that are going away, you're going to have to include that in your regimen. If you can't get epitalon, what do you do? I think your best bet, number one, there's this very interesting lecture who was talking about actually one of the reasons that if you look at Asian traditions, that being upside down, like if you look at yoga postures, being upside down was useful, is because people who spent more time in an upside down position had less of the calcification of their pineal gland. So that would be another thing you could do, is actually at least spend some time with your head below, just bent over, like in a downward dog kind of position, at least some position like that to get more blood to your head. So that was it was a whole interesting study looking at the pineal gland and its relation to neurodegenerative diseases, and how actually being upside down was one of the things that helped. So it was interesting. Otherwise, I think our best bet is the more stimulus you can give a gland, the better you're going to do, and that's going to be by being outside or simulating light.
I mean, there's been some studies that it increases telomeres by about 33%. It decreases cardiovascular disease by as much.
All those things are linked to circadian rhythm, right?
So that makes sense. So let's move to the neuropeptides, or the nootropics, stuff that helps us with thinking or memory, learning. Let's talk about that. There's four main ones. If I could, C-Lank, C-Max, Dihexer, and Cerebrolysin. Unless I missed some, if you could talk about those, and which are your favorites and which ones help. There's some that are very good for athletes, that are good at keep you calm for athletes, and some are good for TBI and stroke.
The C-Lank and C-Max they came from Russia. They're from Dr. Kavinson's lab in Russia, and they were actually designed for the Russian military to help them be more alert and more focused and calmer, so less anxiety and more calm. So if we take that into our world, that has huge benefits, right? So I like to, they're sort of sister peptides, C-Lank and C-Max. They work very well together. I like to think about C-Lank more as our kind of relaxing, settling the brain. So if my anxiety-ridden people who are nervous people, or like if you're an athlete, let's say you're a precision athlete, like you rifle shooting or archery or things like that, precision athletes, C-Lank is a really good thing because it really helps to sort of reduce any kind of anxiety and tension's effect on disturbing brain function. So I love C-Lank for more its anti-anxiety, settling effects, but its biggest use that I use it for is actually as an anti-inflammatory to the brain. So we have so many things now that are causing neuroinflammation. And if we look at neuroinflammatory diseases, like viruses are huge in that realm, and why we're seeing so much brain fog and things like that, post some of those viruses that have come around, that C-Lank can be very, very useful there from a neuroinflammatory perspective. So think about that as the brain settling, put out the fire. C-Max, on the other hand, is going to be more neurostimulatory, and that's more your nootropic. So think about, again, nootropics causing new brain pathways to form, and utilizing more of your brain. Modafinil, Adderall, those are actually nootropic drugs. So basically, those caffeine, those nicotine, those are all nootropic drugs. But of those, probably the safest and that I like is C-Max. Now, these are done as nasal sprays. And I think about nasal sprays is that you can actually get them right to your brain. So there's a direct path between your nose and your brain. And so that basically it's very easy access. You don't have to do it as an injection, you do them as a nasal spray. So C-Lank for settling, C-Max to act as a nootropic effect. C-Lank more anti-inflammatory. That's where I'm going to go to in terms of reducing inflammation in the brain. But C-Max is where I'm going to go if I want better athletic performance, if I want better focus for doing your work, if you want to get that more nootropic benefit, you go to C-Max. I very often use the two together. I might use C-Max in the morning, C-Lank in the evening for people. So if I have these people who are kind of anxiety-ridden, high-performance people, I'll use both of these together. I'll use C-Max when they need this more brain focus, C-Lank to kind of settle the brain down. I do love these peptides. They seem to work really well for some people, and others don't notice as much of an effect. But C-Lank, even in people who don't have anxiety, if you look at neuroinflammatory diseases, of which, if you look at things like Parkinson's and Alzheimer's, those are neuroinflammatory. These are beneficial. If you want to go a little further down that more anti-inflammatory mode, then you go to dihexa. Dihexa can be taken orally or as a transdermal. Dihexa has some interesting research in Parkinson's. So it actually, if you go to like Michael J. Fox's site on Parkinson's, they actually talk about dihexa there. So it has some actually very interesting benefits as a neuroregenerative agent in Parkinson's. So dihexa.
C-Max be used as an alternative to Adderall?
Yeah, basically, when you're looking for that, if you look at what happens in the ADD or ADHD brain, there's all this stimulus coming in, and they're unable to focus the stimulus. Right. So it's sort of like there's all this noise. You don't know what to tune out. The brain doesn't know what to tune out. And so what Adderall does and what C-Max can do, I think, equally effectively, is it actually takes that noise and it can help to focus it. Because if I can sort of shut out the stuff I don't need to be listening to and just attend to the one thing I need to be focused on at that point, I can perform very well. I mean, ADD people are great when you can get them focused in. They're very productive. We need to focus them in. So I like to use C-Max, and you can actually get a very rapid effect from it too. So you can actually get a very nice effect from it. So when you're studying and things like that, you can actually utilize it, before a study period, and then even before an exam, to kind of help settle the brain down, help be more focused. And again, easy. It's a nasal spray. It doesn't have any addictive properties, so you don't have the downsides. It has no stimulant effects. So that's the other thing, is when you look at Adderall, it has the stimulant effects, right? C-Max does not. Like I said, for some people, it's amazing. It's not for everybody. I have people who still need their Adderall, right? So I'm not going to say that it's going to be that this is a substitute for everybody. Don't ever think of anything as right for everybody, but it's always worth a try, because I think this is a very safe, very nice way of helping the brain perform better.
You mentioned dihexa before and Parkinson's. How well? I know it helps for sleep. Dihexa is good for sleep. Is that correct?
I think you're thinking maybe DSIP. Dihexa we don't use that much for sleep.
Okay.
Deep sleep inducing peptide, DSIP, we use a lot more for sleep. I've used dihexa, primarily I've used it for two purposes. A little bit as a nootropic, and some people, they seem to like it better than C-Max. But primarily my Parkinson's patients, because the data on Parkinson's is pretty compelling. And it's also been very interesting for hearing loss. So particularly people who have had damage to the neural, the auditory nerve, dihexa has been helpful, or protective if people are undergoing chemotherapy from auditory nerve hearing loss. And so I've used it primarily or for tinnitus, it can be useful too. So basically, I've used it for those purposes primarily. Some people really find it to have a very nice nootropic benefit. I would say those are a little fewer and far between. I don't find that many people who feel like dihexa is the cure-all to their brain being more focused. I think I get more of that from C-Max than I would from dihexa, or like drugs like modafinil.
And clinically, how well have you seen dihexa work for Parkinson's, and has it anything with Alzheimer's?
Yeah, the Alzheimer's data has been okay on it. And I won't say from my clinical perspective, I found dihexa to be, and I've used it a lot, I have not found it to be all that effective. In Parkinson's is complicated, and you have to address it from a whole lot of perspectives. So it's usually an add-on to a lot of things, but we see very nice improvement in Parkinson's patients when we're utilizing dihexa with other things. You actually have to obviously, work on other pathways that are involved. And I don't know how familiar you are, Carrie, with plasmalogens, but plasmalogens become a really big player here. And plasmalogens, guys, are very specialized lipids, and they make up your cell. They're sort of the coating on your cell membranes and all of your neurons. And so what we know is that when our plasmalogen levels get low, that we have much more neurodegenerative disease. And if you don't replace plasmalogens in neurodegenerative people like Parkinson's and Alzheimer's, I don't think you get anywhere. Most of them have very low plasmalogen levels. You can't eat plasmalogens. They're not available in our diet. You can make them, so your body can make some if everything is optimal and you have some that you've stored from birth, but they get utilized when, or depending on your genetics or depending on stressful events. And when plasmalogens are deplete, your body actually starts eating its own cells in a sense. It starts eating its own neurons. So you start demyelinating nerves. So things like MS, you see this very low single myelin ratios. The ceramides are bad, single myelin is good. And you start destroying the single myelin to put these lipids back into circulation. And so you have to replace plasmalogens with these things too. There's so many, I think you have to always think about peptides are an add-on to a whole lot of other things. And when people start thinking about them as the one pill that's going to cure everything, that's probably not appropriate. You have to fix the other pathology too. And that's what, when you look at
how do you replace the plasmalogens?
The only way right now is, so there are some foods that have fairly high, like sea squirts and scallops, but you don't get, even from those foods, which are a little hard to eat a lot of, you don't get a lot. So prodrome.com, Dane Goodnow is incredible.
He has that blood test, right?
And yeah, he does a blood test called Prodrome Scan, where we can look at plasmalogen levels, which I love because you can really see exactly what people need. But then you can use, there's plasmalogens that you can take orally. So he has synthesized a plasmalogen that replicates our own plasmalogens. The only place they're available is on prodrome.com. And there's two types. There's prodrome glia. Think about prodrome glia as the remyelinating, laying back all the myelin, settling down all the nervous system. And then the prodrome neuro, which is like turning the volume back up. It's getting electricity going, charged again. And these are amazing for people who have neurodegenerative diseases. I mean, honestly, if you get to a high enough dose, we've seen very nice reversal of neurodegenerative diseases. He's investigating them in autism, ALS. So really, those are very, very, very big players in all these neurodegenerative diseases.
Wow, that's unbelievable information. So Cerebrolysin has been used in 50 countries and treated first-line therapy for TBI and stroke in Austria. Can you talk a little bit about Cerebrolysin? And I don't think we could get it here, or it's difficult to get it here, but maybe in the future.
Cerebrolysin is amazing. We've spent a lot of time in Austria at the pharmacy at Everpharma, where they make Cerebrolysin, and a lovely company. But as you said, if you have a traumatic brain injury, you have a stroke, one of the first things they're going to do is high dose Cerebrolysin there. Here, not available. And there's little incentive to bring Cerebrolysin over from Austria. Unfortunately, they have such a huge market in other countries, particularly Asia, and it would cost them so much money to try and get it approved here, because Cerebrolysin is actually a conglomerate of a whole lot of peptides. It basically is porcine brain in a sense. It's, so it's a bunch of peptides from the brain, from pigs. And so basically it would have to have over 50 substances go through FDA approval. It would take them so long and so much money that talking to the company, they're not particularly interested in bringing it to the US. It's too successful other places. But we can get it. When we first got it, we actually had to travel to Austria, put it in little suitcases and bring it across. It's the only way we could get it here. We can get it mailed. It gets stuck in customs quite frequently, but we can get it mailed to us from the pharmacy now. And, we have to order it in small amounts. It's best utilized IV at high doses. So when we're treating traumatic brain injuries, when we're treating post-stroke people, and obviously we're not getting them acutely, right? That's what's sad. If you're in the hospital with an acute brain injury, you should get this stuff right then. We're getting them after they're out of the hospital 3 months later, which is sad. But we can still make progress. So we have people come in, we run an IV, we'll have them stay for a week, run an IV every day, have them come back a few months later, do it again. And some of our people who live locally, we will just do it on a weekly basis with them. But Cerebrolysin is one of the few things that has been shown to repair nerves. We used to say you can't, right? You can't repair nerves that have been damaged. This repairs the nerves that has been damaged. So, we're seeing it with the anosmia after COVID, the lots of, taste and smell after COVID. That's a neural damage, and we've seen Cerebrolysin very beneficial in those cases as well. So it is think of it that as a neural reparative. really good for dementia patients too. Once you get the inflammatory stuff under control, you get plasmalogens back on board, run cerebrolysin to get that neuroreparative effect. It is an amazing compound, amazing. And it makes me very sad that unfortunately you can't get it very easily here.
Got it. Well, hopefully in the future, and there are great doctors like you that are helping patients. Growth hormones, we need growth hormones obviously to grow, for body mass, bone density, helps with glucose, learning and memory. And there's a number of ways to increase growth hormones through using the technique of secretagogues. If you could talk a little bit about that and the different ones that are being used.
So when you look at growth hormone, and when we talk about thymic involution, some of the biggest studies on thymic involution, trying to regain thymic function, has been with using growth hormone secretagogues or growth hormone itself. So we know that growth hormone is actually paramount to actually preserving some of these tissues that we're losing, like the pineal gland, like the thymus gland, that having more growth hormone on board, those glands stay functional longer. So it is, if you think about when we're young and healthy, we have a lot of growth hormone, we heal, we recover, we lose growth hormone as we age. And you can take growth hormone. The problem with taking growth hormone is that you can start to get receptor upregulation when you keep feeding growth hormone in. It becomes, you get what's called receptor involution. So the receptors become less sensitive to it and eventually permanently not very sensitive. And so it actually starts losing efficacy, and even your own growth hormone will not work anymore because the receptors are gone or so not functioning. So we really don't advise that. It also has a lot more side effects. If you're going to use growth hormone, you can use it periodically, but I don't like people being on it continuously. So probably the safer way to go is what we call secretagogues. So our pituitary gland, we can encourage it to make more growth hormone and release more growth hormone simply by giving it the fuel to do that. So you can use what are called growth hormone GHRHs and GHRPs, growth hormone-related peptides, and growth hormone-releasing hormones and growth hormone-releasing peptides. So,
We're coming up to the break, Dr. Yurth. Great information. We'll be back in just a moment. This is Dr. Kerry Gill.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
This is Dr. Kerry Gill, back with Dr. Elizabeth Yurth, co-founder and chief medical officer of Boulder Longevity Institute. We're talking anti-aging, we're talking peptides, and soon we're going to talk about repurposed medications that are very interesting. But let's finish with the growth hormones. There's CJC, there's epimorelin, semorelin, and tesmorelin. Tell us about those.
CJC and ipamorelin are usually put together. So ipamorelin is a growth hormone releasing peptide. CJC is a growth hormone releasing hormone. I like to think about this as putting gas in the car and then stepping on that gas, right? So you need the growth hormone releasing hormone to just make more and then put on the gas. They're best used together. So CJC and ipamorelin used together. You can just use ipamorelin by itself, just the growth hormone releasing peptide. So ipamorelin or tesmorelin can just be used alone. Those are both growth hormone releasing peptides. The growth hormone releasing hormone added together with that is going to markedly increase the efficacy. So if I can increase the amount of growth hormone I have and step on the gas, I'm going to do better than just stepping on the gas. Because it's getting harder and harder to get CJC and ipamorelin, which I think are the sort of mainstay of longevity, we've gotten a lot more to tesmorelin. Tesmorelin is actually an FDA-approved drug, so it's going to be available. It's stronger than ipamorelin, so it has much better efficacy, but also with more side effects. So the problem with tesmorelin is it does work very well to increase growth hormone. Personally, I can't take it. I get horrible side effects from it. I get horrible edema from it. I get neuropathy from it. So, and it can be very stimulating to the immune system. So anybody with autoimmune disease, if you put them on tesmorelin, a lot of times you'll see them go out of control. So it's a little bit with caution, but people love it who tolerate it well, love it because it does very nicely increase what's called IGF. So growth hormone is released, tells the liver to produce insulin-like growth factor, IGF, and IGF is where the money is. IGF is what circulates around, and there's IGF receptors on all of our organs and all of our cells. So basically that IGF level is what's important. And what we found is that IGF level, probably for optimal longevity as we age, is about 170 to 190. So in that kind of IGF range. So what we do is measure IGF, and we try and target that range of IGF. So testosterone, stronger, more side effects. CJC and ipamorelin, probably the best just for kind of ongoing use. Usually you don't do these continuously. So there's two methods. You can do CJC and ipamorelin 5 out of 7 days of the week. So take 2 days off, or some people will cycle it 3 months on, 1 month off, 3 months on, 1 month off. With testosterone, because it's stronger, usually you'll do 6-week cycles, 6 weeks on, 6 weeks off, 6 weeks on, or sometimes 12 weeks, depending on your tolerance of it. And then you got some more.
IGF is insulin-like growth factor.
It's like growth factor, right?
So isn't there a chewable one in testosterone? Could they make it chewable or no? Or is it only injected?
I don't know of one, Carrie. If you know of one, I don't know of one.
Okay. So let's go to MOTS-c. This is very important because it's the mitochondria, and this is probably my favorite.
Yeah.
You can talk about MOTS-c.
Again, what else happens when we age? One of the biggest things that happens is we lose mitochondrial function. That's why, you watch little kids playing, you're like, oh my God, I wish I had that energy. So look at old people, they don't have energy anymore. Why is that? It's because you've lost mitochondrial function. And there's lots of things that knock out mitochondria. Age in itself knocks out mitochondria, but so do viruses, so does stress knock out mitochondria. Remember, mitochondria are energy powerhouses. They're also very cool in that they are their own little beings inside our cells. They were their own little bacteria that invaded us and turned us from anaerobic beings to aerobic beings. So they have their own DNA. They've got their own very specific cell membrane that's hard to penetrate. They've got their own, they're separate from your DNA. It's DNA inherited only from your mother. So you've only got one source of DNA, meaning it's much more easily damaged. There's more mutations, mitochondrial mutations in people. So our mitochondria are very vulnerable. And unfortunately, without mitochondria, a good mitochondrial function, we lose energy. So if you look at, chronic fatigue syndromes, long COVID people, those people have mitochondrial dysfunction. Even if cancer is a mitochondrial disease now. One of the ways mitochondria repair themselves is by producing their own peptides. MOTS-c is one of those peptides. So MOTS-c is made by the mitochondrial DNA. It then circulates out into the nucleus, and it codes to say, I need help. Let's make more mitochondria. So it's a mitochondrial gene, basically, and it plays a really key role in mitochondrial biogenesis, meaning making more mitochondria, but also in regulating, turning glucose into energy. So the cool studies on MOTS-c, when you look at its improvement in insulin sensitivity and increased glucose into muscle cells. And remember we talked about that mTOR AMPK pathway? MOTS-c can actually stimulate energy production, but also stimulate AMPK. So you gain that more long endurance-y, long life kind of thing from it. So we know that this is that nice balance to the mTOR, right? So we've got the high protein, but how can I fix that? Well, if I can get mitochondria functioning well, then I can actually have the other side working too. In mice, they did a really good study on mice. They gave these middle-aged and old mice MOTS-c and had them run on a treadmill. 100 mice, 99 of them could run significantly longer just with one dose of MOTS-c. For some reason, one didn't. Who knows what was wrong with him? But basically, it is not just kind of rejuvenating the mitochondria, but actually reprogramming them to make better energy production. This is another peptide that I think everybody should cycle periodically because it's, again, our mitochondrial function is going to decline with age. How do you keep it up? Exercise. So same thing happens when I exercise, I produce MOTS-c. So MOTS-c has been considered what's called an exercise mimetic. It's one of the things that happens as we exercise that tells us to make more mitochondria, that tells us to utilize glucose better. And so they're researching it a lot in the drug world to give to people who can't exercise to stimulate exercise. So it may be as close as we can come to exercise in a pill.
Look, typically it's given injection for how long, how many times a week?
Yeah, typically an injection, and how long and how many times a week depends on what I'm treating. So if I have somebody who's very sick, I might do it daily for a little while. So I might actually do like a 6 milligram course daily for a little while of it. And then maybe start decreasing it. Otherwise, you can do like a 3 time a week dosing of it. If you're more of a normal person and you're just utilizing it kind of for regeneration and doing like a 6-week course, it's a relatively expensive peptide. So price is a limiting factor on that. Are people who have really severe chronic fatigue symptoms, who have lost all energy, who can't exercise at all, I will have to high dose them for usually as long as 12 weeks. To really, and some people even longer than that, honestly, because we're seeing so much of this actually with our chronic fatigue, long COVID people.
The beauty peptide, GHK-Copper.
GHK-Copper.
And for wrinkles, collagen, also skin remodeling, wound healing. How well does it work for wrinkles, and does it really work?
GHK-Copper was discovered by Laurent Picard, who's a little French researcher. He's now like 90, but he still lectures. And it is again, it's a peptide that we make. So it's again an endogenous peptide that we make, and it activates collagen synthesis. It also positively influences about 500 different genes. So it is really a very small peptide, 3 amino acids. And it can insert itself into the genome and positively influence about 500 longevity-based genes. So it probably has some other longevity properties besides its wound healing, collagen synthesis properties. So topically, you can use it for skin. It's increasing collagen synthesis and reducing wrinkles by thickening collagen, and used on a consistent basis. There is GHK-Copper in some expensive skin creams, but it's usually in very small concentrations. So we'll get it compounded at a higher concentration. You can actually mix it with something called argireline and lufazole. Argireline and lufazole are kind of Botox peptides. So they actually basically work to relax the just like Botox does. They work very similarly to Botox to actually relax the muscles and get rid of wrinkles. So if you use those three together, you can actually really impact wrinkles. I have people who love GHK-Copper. Also can be used for hair growth. You can microneedle and use it for hair growth as well, and it's very good for stimulating hair growth. I use it a lot in wound healing. My mom, at the end of her life, she had a wound on her toe. They were going to have to amputate her toe, which, 90 years old is not a great thing. And just by using GHK-Copper, I got this, and none of the antibiotics worked, nothing else. By using GHK-Copper and this what's called an antimicrobial peptide called LL37, I totally got this wound to heal. And so you can use it for wound healing. You can actually topically apply it, or if you have something like a surgery, inject it close to the site. It can also be used systemically. Again, that's for its longevity effects. And its healing effect. So it's one of my protocol post-surgery on people or post-injury. I will always put them on GHK-Copper, BPC, and thymosin beta-4 because the GHK-Copper is going to help the collagen remodeling and keep you from getting scar tissue. So it keeps you from that collagen from getting the thick, abnormal collagen.
Is there a brand that people could use for wrinkles, or is
we just get it compounded from our compounding pharmacies. So I don't really know of a specific brand out there I'd recommend. So we usually get it compounded because then we can get it in a high concentration. So you can usually get it from compounding pharmacies.
This is such great information. Now I'm going to go to repurposed drugs with the time that we have less. Let's talk about the PDE5 inhibitors, giving that to women, Viagra, Cialis, giving that to not only men, but to women. Tell us about that. Lower the risk of Alzheimer's.
The phosphodiesterase 5 inhibitors are, you guys know them as Viagra and Cialis. And people, almost all my patients are on a low dose of tadalafil, 5 milligrams a day, men and women, right? The women always go fill it and they say the pharmacists laugh at them. But why? Well, really, we've used them for years for erectile dysfunction. But what they found was that these men who were using for erectile dysfunction, they had much less cardiac disease and much less dementia. So studies came out like in 2014, 2018, showing the marked improvement in cardiovascular function with the PDE5 inhibitors. So they now fall into the classification of actually longevity drugs because they're so cardioprotective and neuroprotective. Guys who are taking Viagra regularly, they actually had a 70% reduction in Alzheimer's. So by using a low dose of these on a regular basis, remember, you're improving vascular flow. Improving vascular flow is going to help my brain, it's going to help my heart, it's going to help my extremities, it's going to help my muscle. Why they're a bad drug.
At the break, we were talking about why women and men should both be taking Viagra, or actually Cialis, 5 milligrams a day, why it's helping us. How about caffeine is supposedly a non-selective PDE inhibitor or tribulus is a natural. Anything good with either one of those?
I think they're beneficial. I mean, caffeine gets a bad rap, right? And if you have certain genetics and don't tolerate it because it's too much of a stimulant, but it has some definite benefits as a non-specific PDE5 inhibitor. So basically, I think that if you can get your doctor to prescribe you a low dose of Cialis, tadalafil 5 milligrams, it's a really cheap, easy way. You're going to get this big vasodilatory effect, and you're going to have to take in the literature because they'll wonder why you're a 6-year-old woman asking for Cialis, but the literature is, I think, I take these drugs, I have all my patients on them, even improving exercise performance. So if you take it before you exercise, remember, that's why these are banned WADA substances. Improve blood flow to my muscle, I can exercise harder and longer. I can get more muscle pump. So they basically, by using 5 milligrams of tadalafil before exercise, you can increase exercise performance. But I use, again, with a 70% reduction in dementia risk with this drug. Why would you not take it? That's my biggest fear in life.
And heart protection with
and the cardiac protection, right? It was substantial. I mean, the heart failure is markedly reduced in men who are taking these drugs. So this is all kind of secondarily found out, like we do with a lot of repurposed drugs. Is like we go back and look at the mechanisms of actions, and the PDE5 inhibitors actually cross a lot of the boxes off in terms of longevity. I think they're going to find their way into sort of the major player in longevity protocols.
And is there a longevity benefits to Z-Pak, that antibiotic?
Yeah, azithromycin is interesting, right? There's a couple of antibiotics that have been actually shown, and I love azithromycin because it has antiviral and antibacterial properties. And I know we get very afraid of taking too many antibiotics and getting antibiotic resistance. So obviously don't want to overuse these, but taking a course of Z-Pak, which most of us end up doing because we get, I don't know, some little strep throat or something, but azithromycin is markedly anti-inflammatory, and then was recently found to be what's called a senolytic, meaning, as we age, we accumulate senescent cells, and these are cells that are sort of stuck in this mitotic cycle. They don't die. A normal cell is designed that when it gets damaged enough, it kills itself. It's called autophagy, right? But as we age, that process gets messed up, and now we have these old cells filled with damaged proteins that are just staying alive. We call them zombie cells because they spew out these proteins, and these proteins start damaging the cells around them. So one zombie cell turns to 2, turns to 4, turns to 16. So we always are looking for senolytic agents, things that kill senescent cells. And azithromycin turned out to be a very good senolytic. It actually had a single low dose of azithromycin killed 97% of senescent cells, and healthy cells were not touched. 97% with one single low dose. So if you do a Z-Pak, once or twice a year, are we sort of cleaning house? We're getting rid of this massive amount of senescence. They also, interesting enough, azithromycin and doxycycline, I think, did this too, had some very important effects on mitochondrial function too. So they actually had some mitochondrial benefits too. So here's where I know you look at the antibiotics, and everybody's like, oh, antibiotics are bad, in terms of my gut being all messed up. But azithromycin has some very, very interesting properties.
Does it negatively affect the gut or not too bad?
All antibiotics are going to cause some. Azithromycin much less than most. Here's the little trick. So lactulose, which is a cheap, easy prescription. We used to use it for constipation, still do, particularly in pediatric population, use it for constipation, but at a very low dose. You just take about a tablespoon while you're taking the antibiotic. Lactulose was shown to protect the gut microbiome when people were on antibiotics. So if you take a course of lactulose while you're taking the antibiotic, it actually kept the gut microbiome stable. So when I put people on an antibiotic, I had them do a little tablespoon of lactulose a day, and that protects the gut microbiome.
Let's go to spermidine, since you talked about
autophagy.
Yeah. Tell me about spermidine.
Spermidine is an autophagy-inducing agent. It actually has a lot of beneficial properties. So basically, spermidine is, if you think about it, it primarily is what's called a polyamine. And polyamines are made by our gut. There's 3 of them: putrescine, spermine, and spermidine. Spermidine, probably the most important. Funny name because it was first isolated out of semen. So basically, isolated out of semen, and So that's how it got its name, spermidine. It's in very high concentrations in semen and breast milk. And you know that anything that's in high concentration in semen and breast milk is probably really important to life. So it's actually really found to be a very, very important element. And as we age, we see spermidine levels decline. We also see certain populations eat higher spermidine diets. Like in the Mediterranean type diet is a higher spermidine diet. So is Asian diet a higher spermidine diet. So people who actually had a higher spermidine diets would have higher levels. So basically, we found that if you could supplement spermidine, you can actually help with a couple of things. Number one, it's a really good immune modulator. So it actually is a modulator of T cell differentiation. We talked about that, thymosin alpha-1. Here's a much easier thing to get than thymosin alpha-1. It actually has some similar properties to T cell differentiation and function. So if you put people on spermidine and have them give them a vaccine, they had a much better antibody response to it. Also some interesting anti-tumor properties for that. But it probably takes a little higher dose than just a kind of consistent regular dose. But a little higher dose, it much like what we talked about with azithromycin, induces autophagy, and particularly mitophagy. It gets rid of the damaged mitochondria, allows new healthy mitochondria to come into play. So that combination of its effects on immune function and its effect on inducing autophagy puts it kind of in one of my top of my list of supplements that I think people should do on a consistent basis. And the way I do spermidine, I have people do a small dose, like a 2 milligram dose every day. And then periodically, I have them do a high dose. They make these little pro packets, like 6 milligram doses. And you do a 6 milligram dose like 4 times a year. Clean the house, right? Clean out the trash. Because I think the smaller dose is not enough to induce autophagy. I think you have to do higher dose. Spermidine's also been shown to be very neuroprotective as well. So it's one of those things that probably, if you look at things that are easy to do in terms of longevity for neuroprotection, for immune protection, spermidine is a really easy thing to add to your regimen.
You have a brand that you recommend?
Yeah, I like Spermidine Life. It was one of the first ones that came to the U.S. Because it actually comes from Austria, and it's made from a wheat germ extract. That said, it's actually probably even safe for celiacs to take. That's like a long explanation why, but it's made from a very specific type of wheat germ that only found available there. And if you were to find that same extract here, it would probably be full of glyphosates. So so it's a very, very clean product. And so I like that one because I think it's probably one of the cleanest, purest products on the market. And they have the pro level where you can get the little 6 milligram packs or 2 milligrams. They have it kind of in multi-dose.
And let's kind of finish up with urolithin A as another designer, a new supplement that people don't know much about.
Urolithin A, I like to think of in my mitochondrial regime. So go back. What are our aging hallmarks? Fix the thymus. We're going to do that easy supplement to fix the thymus, spermidine, right? So we talked about the thymic peptides and all those other things. So let's go to the next thing that we're losing, mitochondrial function. So mitochondria are every one of you. I don't care who you are. If you are aging, you have less mitochondria than your 20-year-old does. So basically, urolithin A is this natural occurring compound that's made from when you eat pomegranates, from metabolism of the gut microbiome of pomegranate, but only a small percentage of people seem to be actually able to make urolithin A. So what they found is that if you give it, you have this significant activity working on the mitochondrial membrane, and it's been shown to be anti-inflammatory, antioxidant, anti-tumor. It promotes muscle synthesis or basically protein synthesis through muscle growth, and a couple of pathways it's working there. It actually improves mitochondrial membrane function. So it's actually one of the few supplements that seems to be able to work at the mitochondria. Very few things get into the mitochondria. Urolithin A actually does. So it's my first go-to for people, when you have modesty, you have all these expensive things. Here's my first go-to is always for mitochondrial dysfunction is urolithin A. The studies on urolithin A, even in high-level athletes, when they were given urolithin A, they took professional basketball players. Even with high-level athletes, their performance improved with urolithin A. So very, very few people will not have improved exercise performance. And if you're somebody who is low energy, who has low mitochondrial function, then this is an essential supplement.
Give me a brand.
Yeah, so I hate to tout them because Mitopure is the one brand that actually has the rights to it. And, and it's a little harder to get. Doublewood made it for a while. They had a really good, but Mitopure is owned by Nestle, and Nestle thinks they have the rights to urolithin
Right,
A.
we have to finish up the show. Dr. Elizabeth Yurth, thank you for joining me. Where can people find you?
BotoLongevity.com or BLI.academy. Join our academy. Encourage you guys to do that, where you can learn all this stuff. You can become your own doctors. That's kind of our goal, make you smarter so that you don't have to depend on your doctor who doesn't know this stuff. So go to those sites, take a look, join our academy, and love to see you there.
This is Dr. Kerry Gelb. We'll see you next week.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oiebroadcasting.com and sign up today.